Okay, let's get into this. For this deep dive, we're looking at sources from Professor Lin, uh, really focusing on this major paradox around vaccines, politics, and, well, critical thinking.
Exactly. It's quite the situation. Our mission, really, is to unpack this contradiction we're seeing between President Trump's, let's say, anti-vaccine political stance and then his own personal actions.
And the flashpoint, the thing that really kicked this off was October 10th, just recently in 2025. President Trump gets a flu shot, okay, but also a COVID vaccine booster.
Right. And this wasn't exactly kept quiet. Massive media coverage instantly, which, makes sense given the political context, particularly with his Secretary of Health.
Ah, yes, that's where it gets really complicated.
It really does.
Yeah.
Because Trump's Secretary of Health is Robert F. Kennedy Jr., who, as many know, has a very long history of anti-vaccine activism.
So the headlines basically wrote themselves.
Pretty much. The sources we have are full of them. Things like Trump humiliates RFK Jr. with surprise COVID booster move. It framed it immediately as, well, a direct contradiction to his own appointee's platform.
Yeah, I saw those. It really hammers home the hypocrisy, doesn't it? The media pointed out, look, he's getting multiple vaccines that his allies say are poison.
Exactly, poison. While his own health secretary is actively trying to limit vaccine access for Americans and generally sowing distrust, it's quite the disconnect.
Which brings us, I think, to a core challenge for anyone trying to make sense of this applying critical thinking when political figures seem to be, well, misusing health data.
That's the heart of it. We need to look closely at the specific claims being made, particularly by the Secretary of Health himself.
Okay, so let's pivot to that specific myth. The source material you mentioned debunks something specific RFK Jr. said about the COVID shots. What was the claim?
Yeah, so during a Louisiana House meeting, the exact year isn't specified in this source, but the claim is clear. RFK Jr. stated that the COVID vaccine is, and I quote, the deadliest vaccine ever made.
The deadliest ever made. That's a huge claim. What was his reasoning for saying that?
Well, his rationale was based on comparing raw numbers. He argued that more people died within 8 months of getting a COVID shot than died following, I think it was 72 other vaccines combined over the last 30 years.
Okay, on the surface, that sounds alarming. But for someone listening, maybe without a deep biomedical background, why is that comparison so flawed? What's wrong with just looking at the raw death counts?
Oh, well, that's where the critical thinking piece comes in. The sources highlight a major logical flaw. It's all about scale and context, you see. The COVID vaccine campaign was unprecedented, billions of doses given globally in a very short window.
Billions. Okay.
Billions. And the data he's likely citing comes from passive reporting systems like V8 years in the U.S. These systems collect any report of an adverse event after vaccination, whether the vaccine caused it or not. It could be completely unrelated.
Right, so correlation isn't causation, especially with those kinds of numbers.
Precisely. So comparing those raw, unverified reports from billions of doses over just 8 months to the confirmed, investigated deaths linked to 72 different vaccines given to vastly smaller groups over 30 years.
Yeah.
It's just not statistically sound. It's misleading.
It's like comparing, I don't know, car accidents in a single city during rush hour to accidents across an entire continent over decades. The scale is just completely off.
That's a good analogy. And the actual evidence, the counterfact presented in the sources, points in the opposite direction. Far from being the deadliest, estimates suggest the COVID vaccination effort actually saved nearly 15 million lives globally.
15 million lives saved. That's quite the contrast to deadliest ever made.
It really is. And this leads us straight into the political fallout, the contradiction in how things are being governed.
So talk about that. What promises were made versus what actually happened?
Well, during his confirmation hearings back in January or February, RFK Jr., despite his known views, made several pledges. He said he wouldn't interfere with the vaccine system, he'd work within the existing safety frameworks, and crucially, he'd maintain the CDC's ACIP.
And ACIP, just to remind listeners, that's the Advisory Committee on Immunization Practices. They're the independent body that recommends vaccine schedules in the U.S. based on science, not politics.
Exactly that. Hugely important body. Yet the sources state very clearly that since he was confirmed in February, he has, quote, violated all these promises.
How so? What policies changed?
Key examples include actions that undermine the ACIP process itself and, perhaps most significantly, ending federal support for universal COVID vaccination for all Americans, basically degrading the very public health infrastructure the president himself just used.
Wow. So the message is sort of, do as I say, not as I do. Or maybe do as I privately do.
It certainly looks that way, and this disconnect wasn't missed. It even popped up in pop culture. Jimmy Kimmel was on Saturday Night Live the weekend after Trump got the booster.
Oh, yeah. What did he say?
He had this joke about how, while Trump was getting his shots, RFK Jr. was probably outside the room, metaphorically, screaming and crying and pounding on the door.
That pretty much captures the visual, doesn't it? The sheer absurdity of the situation.
It sums up the political calculation, doesn't it? Attack the system in public, maybe gain some political points, but rely on that same system privately when your own health is on the line. The focus seems to shift away from public health towards, well, political gamesmanship.
So wrapping this up, what's the big takeaway here for you, the listener? I mean, the sources Professor Lin provided paint a really stark picture.
I think it's a powerful case study in needing to separate political rhetoric from, scientific reality and personal actions. It forces you to ask, whose advice do you trust? The public pronouncements aimed at voters or the private actions based on, presumably, scientific guidance?
The core lesson really seems to be about critical thinking, right? Especially when you see data being used in ways that might be statistically, well, shaky or politically motivated.
Absolutely. You have to question the context, the scale, the methodology behind any claim, especially dramatic ones.
Which leaves us with a final thought to chew on. If powerful political figures privately trust the science enough to get vaccinated themselves, what does that signal about the information they choose to broadcast publicly about those same vaccines? That gap, that dissonance. Maybe that's the real health risk we need to be thinking critically about.